All right, so you finished physical therapy, you did the clamshells, you did the band walks, you did all the stretches. You probably also got an MRI, and maybe that's totally clear, but you're still having pain, you're still having limitations, and you definitely don't feel confident enough to get back to basketball or training hard in the gym. And I hear this all the time. It's super common with people in their 20s, 30s, and 40s that still have higher aspirations than just walking around and getting off the toilet. So if any of that resonates with you, this video is going to be for you. We're going to dive into exactly why that is and what to do about it. So there are several reasons why this is so common. And number one is that traditional physical therapy typically focuses on getting out of pain or at least reducing the pain effect or experience that you're having, right? So hot packs, ice packs, massages, hop on the bike for 10 minutes. All of this stuff just kind of soaks up a bunch of time that you're spending where it could be better elsewhere spent on things that actually improve your readiness and performance, which actually gets us right into number two. PT typically doesn't focus on readiness. It just focuses on baseline level function. They want to get you walking around a little bit better, getting up and down from a chair, off the toilet a little bit better, and just on general day-to-day basis. That's what they're focusing on. They're not actually getting you ready to perform at a high level, to have the power, the strength, the coordination, all of these qualities that you need to be able to get back in the gym and lift heavy again, get back on the court and run fives if you want to do that. Number three, if your MRI was clear, and in many cases, even if it wasn't clear, but you don't need surgery, an MRI is not going to pick up on your coordination, your load and tissue tolerance, and your body's overall capacity to handle the demands of what you want to get back to. So many people get an MRI or an X-ray and it's completely clear, it's negative, they don't see anything in there, but their knee still hurts or somewhere else in their body. And they're not sure exactly why that is, and no one really gives them an answer. You might get diagnosed with, oh, you got patellofemoral pain syndrome, you got chondromalacia patella, maybe you have a little arthritis in there. I don't know. They throw all these words at you and they're not really helpful. They just all mean the same thing, that it hurts here, but no one tells you why or what to actually do about it. And the fourth reason why this is so common is that when you're going to physical therapy, or typically when you're trying to treat things on your own, you're not zooming out and seeing the bigger picture. How is the entire movement system, how is your entire body moving together? If things aren't optimized to function together efficiently, you're ultimately going to hit a ceiling effect of what you're able to achieve. And then when you get back into things that are more meaningful and complex, your body has no idea what to do. So now we need to understand what actually needs to happen in order to get out of pain back to that high level of function and performance that you want. So number one, if we're talking about the knee, we have to be able to teach the knee how to bend comfortably again. If you have pain just every time you bend your knee, or you wince, or you clench your entire body fist every time your knee has to bend, we have to clean that up first. And there are mechanics involved with the knee that are often overlooked in traditional rehab, like the little rotations at the knee, which we can make a future video about, or what is happening at your foot. A lot of PT clinics or stuff that you're going to find online isn't going to talk about any of this stuff. So we need to be able to focus on that and improve that movement so you don't wince every time you bend your knee. Then when you can bend your knee a little bit more comfortably, we can focus on loading the tissues around the knee in a way where they can actually lengthen and contract to their full range of motion. So your quads, your hamstrings, even your gastroc and your soleus, your calf muscles, all need to be able to function really, really well, get super strong, but in the context of the knee being nice and comfy and safe. From there, we need to be able to absorb force and then reproduce it at higher speeds. So can you quickly stop on a dime? Can you change direction? And can we increase that intensity and the speed in which you do that and have it go really well and successfully? Real quick, if any of this sounds like you, please hit that subscribe button, like this video, drop a comment down below. Let me know what questions you have, what you're dealing with, and if there's anything that I can do better in these videos to make it more valuable for you, I definitely want to do that, so let me know. The other thing is I have a free guide linked in the description below. It teaches you all about these frameworks and concepts that I'm talking about. It's going to teach you how to go from pain all the way up to performance and everything in between. So check that out. Now back to the video. Number two, which is one of the key issues, and I mentioned it just in number one there, is that typically when you get to the end of PT or the own rehab that you're doing, you're not actually getting to the point where you're focusing on deceleration and change direction work. That's a huge piece of end stage rehab that needs to be in there if you want to get back to that higher level of playing and performance that you have aspirations for. Now, if you're someone that can squat really heavy, maybe you can do 225 plus, just an example, or anything with two legs, you feel pretty decent with. Maybe your knee's a little bit cranky, but you can actually power through it. If we were to put you on one leg, I guarantee your ability to produce force on one leg, like a single leg squat or a single leg hop, is going to be drastically different one side compared to the other. Or you may be someone that whenever they get back to their high levels of activities, they might be feeling pretty good prior to that, but as soon as they have to increase that speed and intensity, they're afraid of getting into those knee bent, knees over toes positions. And so their body finds a way to compensate. And if it's not the knee that's going to start barking at you, something else is likely going to come up. And so the final point here, which is really the most important, is that we have to teach your nervous system how to actually feel safe again when you are doing the movements and the movement patterns that you ultimately want to get back to and are meaningful for you. Your nervous system is very smart. It's designed to keep you alive and keep you safe. So any pain or discomfort that you feel is your nervous system perceiving that as a threat. If it's always going to perceive that as a threat when you're walking around, maybe when you're lifting in the gym, or when you're sprinting up and down the court, then you're going to start to get into these compensation patterns where you're fearful of loading that area. So it's still going to be painful. And then you might compensate and start loading other areas, and you just run into some more issues down the line. And so when the nervous system is all jacked up like this, it doesn't always have to be that there is structural damage there. Remember, your MRI is probably clean. There's probably nothing going on there. So we have to teach your nervous system how to adapt and feel safe in and out of these positions that you actually need to get into. So now we're at the point in the video where we can actually talk about what to start doing instead. First and foremost, that knee needs to be able to bend more comfortably. The way we can achieve that is working on the mobility of the knee joint itself and the foot and the ankle. At the knee, in order for the knee to bend more comfortably, we need to work on the rotations at the knee, specifically the internal rotation, the inward rotation of the shin bone. People think of the knee like a door hinge that bends back and forth straight. Doesn't work that way. A little bit of rotation here, we got to get that back. I have several exercises either on this YouTube channel or on my Instagram that you can find restoring the rotation at the knee. The next thing is restoring the mobility of your foot and ankle. If your foot and ankle feels really locked up, you don't have a lot of mobility there, typically people that have painful knees, especially when they bend it, have an inability to pronate their foot, get to the inside of their foot and let their arch kind of flatten towards the ground. That's going to give you more ankle mobility. You're going to be able to absorb force much better, and that knee is going to bend much healthier and better as a result, and you're going to feel more confident loading into those positions. The next thing you want to be able to do is find your loading entry point. So you want to get your quads and your hamstrings going and progressively get them stronger over time within the context of your knee feeling good, nice and safe as you do that. Some ways you can actually start working on that are like a wall sit, a short range knee extension, whether through range of motion if you can tolerate it, or isometrics, or some hamstring curl or bridge variations on a foam roller are a great way to start. Typically, if you've gone through PT, you've probably done a lot of hip strengthening to take the stress off your knee. And while that can be helpful, if we're not loading the tissues directly around the knee, then we're never going to get into that situation where we can get into those deep positions and push out of them when the knee is most dominant. Again, I want to emphasize here, start with activities that are low complexity, low friction, so they're easy to do, they feel good, and that you can start to progress over time. You want to get a big hit in the muscle that you're working with the least amount of pain or provocation that you feel. From there, you can gradually increase the load or change the position to make it more challenging. So maybe you're going through a greater range of motion. Instead of 2 legs of a wall sit or a wall squat, you can go to 1 leg, or maybe you're going to go double leg squat to split squat. There's several things that you can do here that can actually start to target and load things and progressively scale it over time. So once you get through the phases of restoring mobility where you need it and building up tissue capacity, strength, and muscle size in the areas that you need it that I mentioned, then we have to focus on rebuilding the entire system cohesively together in sport-specific activities or the demands that are required to do the thing that you want. So for basketball, sprinting, change of direction, hard starts, and hard stops. You have to be able to do that so that you can easily transfer that right on over to the court so that you feel confident and you've built evidence that your body is going to feel good and you feel successful doing that. Confidence when you get on the court. And that's it. That's the process. Do that. So the take home of all this is that you're not broken, you're just unfinished. All right, your MRI is clear. You went to PT. We just need the right strategy. And so if you're someone that's tired of spinning their wheels, then I recommend hopping on a protocol just like I mentioned. Or if you want more information on how to do this for yourself, I actually have a free guide linked below that teaches you all about how to take yourself from pain back to performance so you can apply all these frameworks and concepts. And if you want a little bit more than that, I actually offer a free call for one-on-one coaching where we can actually talk about your specific situation. I'll give you some clarity on what the heck's going on and also build out a game plan and roadmap for you so you know exactly how to get from where you are to where you want to be. If you feel like the system has failed you and you have no answers left, keep following this channel, hit the subscribe button, drop a comment down below if you have any questions about your specific situation or anything that you want to see, and I'll be sure to put that out for you. And lastly, if you want someone to teamwork this with you, you can grab a discovery call. It's completely free. It's linked in the description below. You and I will go through your entire history, what you've been through, what you've tried, and where you want to get to. And then I will also help build out a roadmap for you as well as just give you clarity on your situation. It's no pressure call at all. If we're a good fit to work together, I'll show you what that looks like, and then we can totally go from there. But feel free to grab that if you want answers for yourself. Take care. I'll talk to you soon.